Hey, everybody. This is Chris.
And Cathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at PetAbility Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links. Proceeds from purchases help to support our show. Thanks for listening.
We hope you enjoy the show. Welcome to PetAbility. I'm your host, Cathy Simon, certified veterinary technician and certified canine rehabilitation practitioner.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Hey, Cathy, how are you?
Hey, Chris, I'm doing all right today. What's going on?
Well, we have published many episodes regarding our cat friends, but they've all been rather specific topics. And today I'm excited because we're going to do a comprehensive cat rehabilitation show. What makes them challenging, what unique conditions cats may have, and hopefully give you pet owners out there some great ideas for helping your feline friend.
And I always want to be aware that we have feline patients and that we have feline friends and feline owner listeners. And so we've done a couple of shows. We did one with Lillian Tardelli on a case study that she did with the cat that she rehabbed. And then we did wobbly cat syndrome with our friend Susie Langer, right?
Yeah.
That's with cerebellar hyperplasia. And then we did the head to tail with our good friend Tanera, who is a cat expert. Yeah.
Yes. And enrichment for cat.
That was a twofer. Yeah. That was a good one.
Yeah. You're absolutely right. We've tried our best not to be remiss regarding, cats, but honestly, Cathy, I have not had the pleasure of rehabbing that many cats. And I think there are a variety of reasons for that. And I want to maybe dispel some of the myths or help owners to know that, cats deserve rehab and that we can indeed help them if we just are able. But before we get into all those details and the nitty gritty that we'd like to share today, I know, one, that you are a huge fan of The Price is Right. And we recently had the passing of Bob Barker, and I know you wanted to talk a little bit about that, and appropriately so.
I think it can't go unnoticed that Bob Barker passed away. I think he was a true advocate for animals, and I think that his foundation is fantastic, and they offer grants to nonprofit organizations to help with animals. And my personal experience is that the Bob Barker Foundation gave a grant to a place that I volunteer for occasionally called Project Perry in Louisa, Virginia. And the gentleman who runs that program, Matt Smith, saves parrots and provides them a sanctuary, a safe place. And most of these parrots have been either in hoarding situations, overbred, abandoned, or neglected, and they have a safe place to go. And the Bob Barker Foundation gave them some money to be able to build some of these aviaries. And so I think he was a good man, and I think he definitely deserves some props from you and I.
Absolutely. And he's been on the air, was on the air for so long. He started in the 50s and, was an animal advocate before maybe, advocacy for our pets was even a thing. Right. And, this is when they were just coming from the barn to the bedroom, if you will. I think, Cathy, and you may be able to help me with this, but he closed every show with a salutation like, don't forget to spay and neuter your pets to control the pet population.
Right. He was a big advocate of spaying and neutering pets to control the pet population. And you've probably never heard that before until you heard it from Bob Barker, right? I mean, you heard it for the
He's
first
a man
time,
ahead of his time.
On that show. So thank you, Bob Barker. I think that I hope all the animals that you have helped are standing at the Rainbow Bridge welcoming you and telling you to come on down, Bob Barker. You deserve.
Very good.
You deserve your kudos. So thank you. Job well done.
After our homage to Bob Barker, let's get into, maybe some of the unique features that our cat friends have, because you and I know, Cathy, that cats are really good at hiding their problems, whether it's
So
an illness or a pain, an orthopedic issue. And, so maybe owners aren't even aware that their cats need physical rehabilitation because, they are really, really good at hiding that, just by their species, their characteristics. And so thus the owners don't seek the care because they're unaware that
right.
it's, even needed, but may also be unaware that it's an option. So again, we put that out there that physical rehab, we treat our cat friends just the same. But I think one of the other things is that, you might see as a challenge, but I love it because it really makes my brain think. But, cats are fiercely independent. And so they do things on their own terms. So how do we trick them into doing the things that are best for them when they are
Yeah.
rehabilitating?
We have to make them think it's their idea.
Yeah, well, that's number one. And I remember that we recently interviewed Dr. Pastor about patellar luxations, which cats get. And she's like, you can't just say, okay, after 2 weeks, walk your cat for 5 minutes like you can
right.
with your dog.
Right. Cats are going to get some of the same common conditions that dogs get. I see a handful of cats, but I don't get a lot of referrals for cats. And I think, one, it's hard to get the cat into the practice, right? We've talked about that before.
Mm-hmm.
It's hard to get the cat into the practice. And two, you're just like you said, we may not even know that the cat has pain until they've shown that they've had some pain.
Right. So let's just talk about that before we get into the specific conditions, because, some things may be associated with pain, some may not. But, that's always one of the drivers for seeking care, right? None of us wants our pet to be in pain, to have pain. So what are some of the things, Cathy, that help pet owners to identify that their cat may be in discomfort?
If your cat's hiding from you, and then that's not a normal behavior. I mean, if your cat hides from you normally, maybe, but if your cat's very social and then all of a sudden is under the bed and doesn't want to come out, I think hiding is high on the top of that list for I don't feel good and I just want to isolate myself where I'm not going to be bothered.
Right. And some of these things that we're going to talk about, can be illness or injury. These are concerning. So again, pay attention, trust your gut. So, like you talked about change in behavior, I think just in general, if your cat's generally playful and now they don't want to play with their toys, they always jump up onto their perch at the window and they're no longer doing that. And then the obvious things, or maybe not so obvious if your cat's kind of a grazer and a finicky eater, but things like stopping eating and those kinds of things can be indicative of pain.
Or sometimes, I mean, some cats can get grouchy when they don't feel well. And if your cat's not typically grouchy, then you're right, change in behavior. What I'd like people to also think about is these sort of subtle things that you may not pick up on unless you're looking for. And the American Animal Hospital Association actually has a scale for feline pain based on their facial expressions. And so I think that's a good thing to check out if you're an owner. And it goes over things like ear position and that sort of orbital tightening and tightening around the muzzle, even whisker position and head position. And so I think those are things that you might not notice, but if you're concerned about your cat, then you can look at this and go, oh, that kind of looks like muzzle tension, or that looks like a weird whisker positions. And people who have cats know what their cat's facial expressions are.
Right.
And they know what they mean because that's how cats command you to do things with their facial expression. But there are a lot of subtleties there for not feeling well or having pain.
And, orthopedically, it could be subtle or maybe more obvious, but things like generalized stiffness or a limp obviously can identify, maybe some sort of orthopedic issue. And, cats are groomers naturally, but if they're excessively grooming an area, maybe licking a paw or, going back toward their hip a lot, that could be indicative of some pain, that their natural instinct is to kind of lick an area to soothe it. And again, if we're listening, oftentimes our animals are indeed talking to us. We just need to know how to listen.
And conversely, Chris, if your cat's not grooming anymore,
yes, that's huge.
Then that's also a sign. Yeah.
So, Cathy, we've talked about some of the less obvious signs, but more obvious signs might be vocalizing, especially if you're trying to move your cat, like from one place to another, nudge them over if they're, lashing out at you or yowling, or if you pick them up and they seem uncomfortable. I mean, that's obvious, but sometimes I think we think it's behavior that's just they don't want to be picked up because They generally don't like to be picked up, but if it's different, if it's associated with some different type of behavior, and then things that are unique to a cat, because most dogs don't have this opportunity, is like accidents outside the litter box. I want to talk about some modifications that I've often employed with litter boxes that, again, we may not be thinking of as cat owners, especially as our cats age and so forth. So we'll get into that a little bit later. And I also think something is, a lot of times cats are on or off, right? I think the average is they sleep like 23 and a half hours a day. But if they seem more lethargic and not moving. So I know in my experience, like my cat would sleep in this area for a few hours and they get up and they go to that area for a few hours. But if they're generally just staying in one place a majority of the day, that's indicative they don't want to move. And why is that? Because it hurts? Exploring those kinds of things.
So why don't we go over some of the common conditions that we might see in cats in rehab? Right.
That's good. Yeah.
I mean, number one, right? Arthritis.
Number one.
That's right. Number one, osteoarthritis.
Yes.
Cats get osteoarthritis just like we do, just like dogs do. They can have arthritis.
Right.
And it's painful. Yeah.
Right. And to your point, exactly. So it's generally a condition associated with either a prior trauma or more generally with aging. And cats are mammals too. So just like what we experience as a person, and then we tend to, we've just started to realize over the last few decades, our dogs experience the same sort of musculoskeletal issues. So do our cats. They are not immune to these disease processes, if you will.
And some of the things that you mentioned already are some of the things to look for with cats with osteoarthritis. So they've limited their jumping, maybe they're hiding, maybe they're having, accidents outside the box.
Limping
is a big one, right? Yeah. Licking over that joint like you talked about. So those are all symptoms too, like we should get that checked out. So I would say osteoarthritis in my book is probably the number one thing that.
Right. So I know we both wanted to really highlight arthritis because it is something that we can help. And, it may not even take that many visits, right? A lot of what we do is educating the owner and home modification and such. But there are I would put this in the category of orthopedic conditions in cats and other mammals. So there are other things, fractures, obviously. And, sometimes cats are very, very skillful. They're acrobats. I have treated cats with fractures that have fallen out of a tree.
Hit by a car.
Oh, yeah. Yep. The trauma of being hit by a car. And it may not even be as obvious as a fracture in an x-ray, but it could be a sprain or strain. So those are injuries to the soft tissues. You pull a muscle, you stretch a ligament too far, and it also results in orthopedic signs like the limping and discomfort. And we can help to heal that faster through things like use of the Medcovet Luma. It seems like we're mentioning it every show these days. It is really effective in treating these soft tissue strains and arthritis.
It's a great option for cats. We talked again about getting these cats into the hospital and how stressful it is for them. And the Medcovet Luma is something that could be done at home, at your convenience, in your cat's comfort, at home. Exactly. Love that we could use the Medcovet Luma. And there's so many things that we can do for cats with osteoarthritis that a lot of it that can be carried out by the owner if we can instruct them. If we can get them to the clinic and we can instruct them, then the owners can carry a lot of these things out.
Right. Because it always starts with an accurate diagnosis and you have to take them to the vet first. But, we've had shows also, primarily focusing on dogs, but, on ACL tears, which is the cruciate ligament of the knee. And that happens in cats. And I've treated that in cats. Hip dysplasia. And sometimes they need surgery because it's so uncomfortable. And we talked to Dr. Davis about FHO surgeries, especially as it relates to severe hip dysplasia. And then we just talked to Dr. Karen Pastor about patellar luxation. And she's done that type of surgery in cats. And I've treated it in cats. And then you mentioned Lillian Tardelli's case study. She was one of the first persons that we interviewed about cats when we started over 3 years ago. And it was just very unique because she was a foster, a volunteer for a rescue organization. And they asked her to take this young kitten who had had an amputation. And she did great, but she really had to use her thinking cap. And the good news is that she's a behaviorist. So that was right in her wheelhouse, how to get Sal to, be deft on 3 legs as quickly as possible and be just like any other cat.
But also, let's mention, cats that have some neurologic conditions. So we're CH cats, so our cats with cerebellar hyperplasia. I see a fair amount of those in therapy. And, I know that I'm not going to cure this cat's problem, but I'm going to be able to, again, show owners how to modify their environment, but also to maximize what the cat has. Balance exercises, core strengthening exercises, even stuff like play is going to help those cats to maintain what they have or to use what they have to the best of their ability.
We try to get back as much as possible if they've lost some function, because really it's all about function. Mm-hmm. And if we can't get more back, then like you said, maintaining what they have or slowing the progression of a disease process. And, a lot of times that falls into that neurologic category, but arthritis is also progressive. One of the things, if I were to pivot here, Cathy, is, a lot of the gold standard, they say oftentimes with animal physical rehabilitation, is the use of hydrotherapy, whether it's a pool or more commonly an underwater treadmill. And I think that a lot of pet owners would be like, you would never get my cat in any water. But can you talk about your experience?
One cat I had that I treated not that long ago had a fibrocartilaginous embolism. And when I got him, his function wasn't great. And putting him in the pool allowed me to do some of the things that he couldn't do on land. So we could float, we could swim, I could put him on the surfboard and sort of rock that and balance him while he was on that. And he did just fine. But you're right. I think it does take a certain type of personality of cat that will maybe allow you to do that. And, we progressed to the underwater treadmill. And then I also had a cat that came in, and this was a really interesting case because this cat was diabetic. They were having difficulty controlling the cat's blood sugars, and exercise was prescribed for this cat. So I saw this cat 2 or 3 times a week, and she did underwater treadmill and swimming. And we were actually successful in partnering with the veterinarian and getting this cat's numbers down. And she did very, very well with that. So she was another good candidate for it. And then I have another cat who's partially paralyzed that we do some swimming exercises with, and he comes in and walks around in his wheelchair, and then we, get him in the pool. So I think it has to be done with respect. I think it has to be done within the cat's limits. I think we have to consider the type of personality and the condition that the cat comes in with.
Right. Is it going to, we always weigh out like the pros and cons, right?
Right.
And each animal that we treat, cat, dog, or otherwise, we have to respect them as individuals and recognize their temperaments. And again, what is the diagnosis and what is the problem that we're trying to address with said therapy tool? Is swimming really going to be beneficial in the end for, a cat that has cerebellar hyperplasia? No. Is it going to be beneficial for a cat that's riddled with arthritis throughout its body? Yeah. And yes, the warm water, the freedom of movement, the gentle strengthening by moving the limbs through the water's resistance, natural resistance, the buoyancy, the ability to open joints up in water just by the natural properties of water. I mean, there's just so many great things. But yes, it probably for most cases would not be, my initial go-to with a cat. You mentioned many cases, Cathy, and I had this Maine Coon patient, and Maine Coons are known for being kind of dog-like, I think, in their personalities, their bigger stature and so forth. But poor Callie, she was older by the time she was referred to me, and she had bilateral elbow dysplasia. She had bilateral luxating patellas, and she had bilateral hip dysplasia. And all of this led to pretty profound arthritis. So initially I was doing hands-on. She was very tolerant. She was a good girl. And range of motion, which we can talk about a little bit, and applying some gentle heat and talking to the owners again about things to do at home or not to allow her to do at home. Maybe she shouldn't be going up and down the stairs. Maybe they carry her, or bringing the litter box nearby so she doesn't have to, walk as far, things like that. But she wasn't really progressing to the degree that we had hoped. And we tried that for a long time. I did treat her in her home, but I also had a clinic that had a pool. And I said, are you guys open to trying to swim, Callie? And initially they were like, No, no. And, sometimes to me, I forget, Maine Coons have long hair and they're like, how are we going to get her dry? I mean, so that's kind of where they went. And I'm like, oh, but this pool can really help all those joints simultaneously. So they eventually brought her in and we swam Callie and we modified a little life vest for her. And she just took off. All those legs were moving at once in the water, and she could hardly stand on land. She always finished with a nice bowel movement, which was the owners were happy about because then they knew, exercise causes the bowels to move. And when you don't exercise, things can get, stuck in there.
I think there might be a misconception that all cats are afraid of water, but not all cats are afraid of water. I think cats might be afraid of the unknown, right, of what's going to happen. But I don't necessarily think that they're bad swimmers or that they might be afraid of swimming or that they cannot swim. I mean, if you look at like large cats in the wild, like tigers and lions, whatever, they swim. They swim.
Right. They have to traverse streams and things like that in the wild.
They swim. And so cats can swim. It just has to be approached, like we said, in a respectful manner and in a fear-free manner.
I would say Callie showed no fear. We went really slow. Again, had some buoyancy. I was in the water with her. We first put her on the stair, got her used to it, then just brought her out, for a few little kicks and then back to the platform where she was on terra firma. And she seemed to really, really, if I were to anthropomorphize, really enjoy that freedom of movement.
But it felt good. I bet it felt really good.
Yeah. So
maybe you don't think of, like you said, maybe it's not your first thinking or that you go to, but with osteoarthritis, but how about weight loss? Things like that with the underwater treadmill. And again, if they're acclimated appropriately and they're doing well. I mean, I always keep the dogs out of the gym area when I'm using this type of equipment, pool or underwater treadmill with the cats, and have the owners with them. But they can do that as well. Sometimes they put one foot on and they just go 1 foot. It's really cute. But eventually, if you get they get the hang of it, and they can walk on the treadmill just like dogs do.
Mm-hmm. I did have a young cat that I put in the underwater treadmill, and
it didn't go well.
I'm embarrassed to say I was not prepared for his verticality. So he had surgery on his knee, and of course he wasn't supposed to be jumping. And I'm in the underwater treadmill with him, and he was walking, everything was fine. So I relaxed a little bit, and then he tried to jump out the top.
Just looking for that moment, for that opportunity.
He was, that exactly as they do.
Never underestimate the intelligence of a cat. Never.
Right. So what's some of the other things besides water, Cathy, we would employ with cats similarly to how we employ rehabilitation in all species of animals?
You know what? One of the things I often go to is massage and passive range of motion. And a lot of cats will enjoy this. I'm treating a cat right now with bilaterally, she's torn her calf muscles. And when I'll massage her right in my lap, Chris, and she just like falls asleep and goes limp and allows me to do this massage and a lot of skin rolling. She loves to have her skin rolled and stretching. Of course, cats are great for stretching and she loves to be stretched. So my go-to a lot is hands-on. If the cat will allow it, hands-on is one of probably my first go-to.
Cathy, you mentioned stretching, and that reminded me of our YouTube channel. And it has, of course, it's with Libby, the dog model, but has all these massage techniques and range of motion techniques and stretching techniques that people can extrapolate to using on their cat.
And they're so good because we just go step by step and break it down. So check out the YouTube channel because you can apply those to the dog to the cat. So thanks for reminding me about that, Chris. But yes, massage is one of my go-tos. Laser, of course, is also one of my go-tos. Medcovet Luma, of course, as we mentioned before, is also one of my go-tos.
Yeah, and I just want to just point out here too that yes, Medcovet Luma is one of our sponsors, but there's a reason for that. And it is a really good device that you can get and partner with your personal veterinarian in protocols and such so that you know that you're applying the laser therapy, the red light therapy in a way that's best for your cat's condition. So, yes, I mean, passive techniques that we do with them, such as massage and stretching, is going to go a long way. And I tend to start there too. But what are the things, Cathy, that make it challenging in terms of exercise? Because so many times I
Yeah.
know in the people world, when people find out that I used to be a physical therapist for people, they automatically equate physical therapy with
Right.
exercise
Right.
and kind of this no pain, no gain mentality. And it's just exercise. But I always say, no, the first thing we do is control pain and inflammation. And then we restore motion. And then we start doing some exercise to build strengthening. But what kinds of tools have you used with our cats for exercise?
It can be tricky, depending on the personality of the cat, but just like if I can, just for movement, if I want to get the cat to move and they will engage in play, just like getting that toy or that feather and slowly moving it can get your cat to crawl. You can get your cat to bat at it. You can get your cat to walk. You can get your cat to move.
One of my first foster cats had an injury where they think he got caught his thigh on a fence and
Ouch.
it ripped, yeah, like through his muscle, and it was this penetrating wound. And
Mm.
actually they said he was very lucky. But beyond wound care, I had to restore the extensibility, the elasticity in those tissues, and then work on strength and that power.
Right.
And so, yes, using a toy like we often do with cats to try to get them to jump if it's appropriate. Again, he was young, he wasn't even a year old. Of course, he needed to jump. And I knew what the diagnosis was. It was going to heal. So we didn't have to do anything protective after a certain period of healing had taken place. So I do think that engaging cats with their toys that they like and being creative in that sense can be awesome.
Yeah. What motivates your cat? Is it praise? Is it toys? Is it food? Because you can use all of those to your advantage
Right.
when trying to get your cats to
And
move.
we are one of the exercises that I use a lot with my dog friends is having them put front feet up, because that switches their
Right.
weight to their hind feet or their
Mhm.
hind legs and instigates some muscle strengthening and things there. And I have used it for elderly cats that have gotten very weak in the hind, and I put their treats in their food bowl and such up on a little step, and they have to kind of climb up and get them, on, and it's worked very well.
And you can use those treat dispensing toys as well, that you have to follow around and the treat comes out to get them to move if they're inclined
Mhm.
to, if they're food motivated. There are lots of things we can do with foraging, things like that, because cats love foraging. Hiding pieces of treats or food in the house and places where cats can go around and up and down and almost like an obstacle course and find their treats. So foraging is a natural thing for them, and most cats enjoy that. And it's a lot of good mental expenditure for your cat to do things like foraging.
We call it foraging in dogs. I think in cats it's hunting. They're
Yes,
hunting
hunting.
for,
All
for
their
their
hunting
their
skills.
prey.
Their hunting skills.
Before we move on, I wanted to just mention one other tool. We've
Mhm.
talked about laser, meaning therapeutic laser, but that laser pointer has been my friend with cat rehabilitation.
Mhm. Right.
So again, if it motivates your cat and, it's not like this stop and then a big pounce, depending on, again, what their diagnosis is. Are we trying to, get them to move? Are we working on weight loss? Because proper weight impacts every diagnostic in terms of, it all
Right.
starts there in terms of weight management, and we can help so much in that. But, if they're carrying around excess pounds, that's no good for any condition. But if they will follow that laser carefully, I've even lured them with a laser to go across cavaletti rails. And those that are listening and are familiar with rehab, it's a series of rails that are usually elevated in height that one needs to step over. So you're working on getting the legs up higher and balance and agility and range of motion. And that's worked really well for me to use a laser pointer, the cat laser.
Yeah, like they love that.
Yep. Yep.
They
And
do
and
love that.
also, when you're talking about just playing with toys and things, I also feel like with people, and I've talked about it with dogs, but cats too, everything starts with the core. And so when they're manipulating anything with their front legs, they're having to engage their core. And that is the start of strengthening when it comes to any being.
Yeah, and I think the other thing you want to consider with these cats, even regardless of what their diagnosis is probably keeping your sessions short,
Oh yeah.
because that's how cats. Yeah, and that's how cats. That's what they do. They'll have these bursts and then they calm down. But I think keeping them in short sessions is probably a good idea for a cat.
So you mentioned talking about changing their home environment. And I've had just single sessions with pet owners, and I started in a mobile practice where I went to pets' homes, and I'm currently doing that now. So it's kind of bookended my career. But that's the part of animal rehab that I love. And I think it's especially helpful for our cats because we not only have to manage their horizontal space, but also their vertical space within their home. So, cats love to climb, cats love to perch on high surfaces. How do we help them? Let's just take arthritis because it's so common. And this is a place I know we can really, really help our cat friends. Traction, just like with people,
Right.
dogs, traction is important. Cats use their claws to grip. And if they lose that or are uncertain where they're going to lose their footing because the surface is too slippery, they're not going to want to go there.
So you're going to want that traction in especially in areas of like transition. So from the carpet to the linoleum in your kitchen, maybe in front of the litter box, right?
Absolutely.
Or at the bottom of the stairs, anywhere where there was going to be carpet to a transition of a slippery surface, you're going to want to maybe put down a yoga mat or a rug runner.
And where they jump down from. So whether it's a window perch, your bed, the human bed that they lay on during the day, it can not only provide traction, but some padding because we want, if they're jumping down onto, a hardwood floor or slate or something like that, not only can it be slippery, but boom, all that impact.
Repetitive concussive forces from jumping down off the bed.
Yes, because what goes up must come down.
Right.
And you mentioned the litter box, but also getting out of their cat bed. So they're all curled up. They may have been sleeping there for a couple of hours. When they get up, arthritis makes them stiff. And if they have to bring their limbs up over the lip of the bed, depending on what kind of bed your cat chooses to sleep in, and then getting that footing as they're transitioning to the floor is critical. So, again, if you can have some sort of rug, yoga mat, just something that they can, grip onto when they're stiff, when they're getting out of their bed, I think that's another key area.
And you can use, just like we talked about in our other show with ramps versus stairs, you can use ramps and stairs with cats too. You can train them to go up and down the ramp or the stairs to high places. So to your bed or to their cat perch or to their window. These are all important spots for your cat. And so having access to them is also important to them and to their mental health, right? To be able to access the window spot. So we can incorporate ramps and stairs, just like we do with dogs to get to some of these places easier.
Oh yeah. And I don't even think it has to be, it can be very DIY because
right.
cats generally are a little better at climbing things than dogs. So, using things in your home, and also they're lighter weight than a lot of our dog friends. So, using a storage container, a box, a piece of wood, and then covering it with the appropriate material so it's not slippery. But yeah, making little transitional, I'm not even going to say steps, but think about platforms, So again, I'm looking here to the right of my desk and I have a plastic storage container full of files. That would be a great platform from which a cat could jump up to there and then to the next level, breaking it down into intermediate heights.
How about adjusting the heights of their food bowls as well? Easier by bringing them up a little bit, bringing that food bowl up a little bit off of the floor. Although there are a lot of cats that do like to eat sort of flat off of a plate. So this may be a personality thing, but you can adjust them to make it easier for them to eat. Just bringing that bowl up a little bit can be helpful.
Or angling the bowl. Like you said, Cathy, a lot of cats eat in a crouched position and that's natural for them. Even watching cats in the wild with their prey, they're kind of crouched over that. But there's some things that we can do. I think there's a relatively new style of cat bowl out that has it's round and almost semi-spherical and that it comes up and over on the back side. So, cats lick a lot when they eat. And so that kibble can be flung out of the bowl or, it can be really messy with wet food, but that brings it kind of back almost like a wave, right? Like they lick and then it comes back into the bowl. And so it just makes it easier for them, especially, again, maybe they have some neck pain or like you said, spinal issues and things. And so, there's a lot of tools out there in terms of the market. If you look at your cat's particular predicament, that may be helpful.
Right. And there's so many great things out there.
And we even have cat leashes now. So your cat may be amenable to being on a
You
leash.
take your cat for a walk, maybe,
Yes.
if they like that sort of
But they
thing.
like to get out of those leashes. So be careful. So let's circle back, Cathy, to the litter box. So you mentioned like putting traction around the litter box. I mentioned earlier bringing it closer to them. I know my mom, cat lover, she usually has more than one cat at a time, but she keeps the litter box in the basement. And when her 18-year-old cat was starting to have accidents, I'm like, well, Mom, maybe she can't go down the stairs and all the way across the basement to the very back wall.
Location. Okay.
And my mom was just thinking selfishly, right? She's like, well, I don't want the litter box near, because as you come up the stairs, there's the kitchen, right? So who wants a litter box near the kitchen? So she put it as far away as possible. But I'm like, poor little Mittens, she can't get there. So
you know what else you can do? I mean, one, you should have, if you have one cat, you should probably have 2 litter boxes.
yes.
So you want,
and she did. Oh, she had multiple litter boxes, but they were all in the same place.
You can have low-sided litter boxes. You can either cut a side lower, or you can get them that are already made that are lower, so that the cat doesn't have to step up and over that lip to get into the box. And I think that's one of the trouble that you see with some of the cats that are defecating outside the box, or maybe even urinating outside the box. Maybe they couldn't just make that last step over the lip of the litter box.
Right? I have been shocked sometimes, because I guess I've never gotten a super high-sided litter box for my own cats, but sometimes they're like 10 inches on the side. So they literally have to like jump into and jump out of the litter box. And if they have arthritis or other balance issues or what have you, that's not going to be comfortable for them.
Right. And they could just stroll in. You may need to put a mat under your litter box, because it might like encourage some of the litter to come out of it, but just, get something underneath it, get your traction, get your yoga mat underneath it, right? And you can clean up your litter and get good traction getting in and out of the litter box.
And for neurological conditions, I've also suggested to people to use something to kind of go like from the outside of the litter box over the edge that, again, may be sharp if you're cutting it down, and then underneath the litter. So I know it's hard to imagine, but, almost like taking a piece of yoga mat or a towel or something like that, and just draping it over that edge so that they can kind of it's almost like a ramp kind of up. And of course, you don't want them to soil that, but you can put it underneath on the inside, underneath the bag.
Right.
So
good idea.
Yeah. So, that you put a garbage bag or whatever as a liner inside the litter box, and then you put that underneath the bag, and then the litter inside. But, sometimes that can help too, because it's not just this sharp vertical edge. So they can kind of climb up and over. And again, if they're dragging a limb or something like that, that can make that easier and prevent some injuries.
Have you ever used any assistive devices with cats? Because I've used the Help Them Up harness and had success as well with Eddie's wheels with some of my patients. Used anything like that before?
I have used a more general sling. I can't remember if I've used Help Them Up. I have not had a cat in a wheelchair, but I would certainly try it. Sometimes the cats will roll or, try to get out of things, but that's not to say that if it's indicated for a condition that I wouldn't try it, because again, it goes back to every cat being an individual.
And the Help Them Up harness for me was, it was like a light bulb. All of a sudden, I was working with a cat who had was post-op brain surgery, and he just on the verge of making those, coordinated movements. And I used the small Help Them Up harness with him, and it just gave him whatever he needed. And he was off with that. Right. So it was wonderful to see that the Help Them Up harness is so versatile. I was able to use it, with my cat patients.
Yes. Yeah. Never discount any tool that you think might be helpful. Never say never, because again, so many pet owners are shocked at what we as rehabbers can do with said cats. And again, sometimes it's, yes, in that case, it's physical assist, but it's also turning that light bulb on for the cat, not just you, but the cat. It's like, oh my gosh, I can do this again, and so we talked to Amy Hesbach a while back about a variety of sensory and physical stimuli to help with return of neurological function and orthopedic functions.
Just simply walking on different surfaces is a proprioceptive exercise for these cats. So grass, gravel, sand, carpet, all different tactile cues.
Right. And if they're inside, you can put bunch blankets and towels and different things around that they have to walk over through on, because I know a lot of our cats are indoor only.
What do you do? What do you do with your non-compliant, cranky cat patient, Chris?
I was just familiarized with the Calm and Cozy Cat Wrap. We interviewed the inventor, Sorrel Levine, who is a vet. And I think that every cat owner should have this, because if you want to trim your cat's nails or need to do anything, procedurally with your cat, and or even doing things like passive range of motion, massage, they are embraced in a gentle hug by a fleece fabric, and you can expose one limb at a time. You can massage even through the wrap. It allows you to work with your cat when they are made to be more calm. Their iciness is suppressed. And again, just opening up, it has various zippers and Velcro tabs and flaps that you can access what you need to rehabilitate your cat. So again, another way to use this wonderful, wonderful wrap.
I like to think of it too as using it even as a therapy tool, because I feel like if you can snug it up and you get that cat in there and they're all snuggled in, that's good body awareness for the cat, to be sort of swaddled in there.
Great point.
So many applications here for the Calm and Cozy Cat Wrap.
So, Cathy, as we're winding down with this episode of Petability, I want to talk about appropriate goal setting. So, I think with anybody, anything, any animal, so I did this a lot as a PT for people, we need to have appropriate goals. Of course, we always want to have quality of life, maximize function. That's fine. But what does that truly mean? Mm-hmm. So I challenge you pet owners out there and the professionals that work with cats to come up with functional goals that if they're getting better with said rehabilitation or home modifications. An example might be no longer going to the bathroom outside the litter box, that they're able to access their perch again. They're going up and down the stairs again on their own. What are some other examples that you think of, Cathy,
Yeah, as soon as owners tell me that their cats are engaging in the things that brought them joy, that's when I get the most excited. So the cat has then joined you on the couch at nighttime when you have your snuggles, or the cat is soliciting attention from you, scratches. If the cat wants to play again, if they're engaged with other animals in the house, if they're reconnecting those relationships with with their best friend who's a dog or their other cat friend. Those are all things to me in my mind that make me go, okay, this cat is feeling better. But I always sit down with the owner first and go, what is it that you expect? What would you like to see? And then we talk about whether those goals are reasonable or not. And like we talked about with these cats with cerebellar hyperplasia, we're not going to cure them, but what can we do for them? And it depends on what, the severity of their condition. But so maybe they're like, well, I'd like to see my cat run a marathon, but it's not going to happen. But can we get that cat to get into the litter box with some low sides and some traction and maybe a little bit of assistance? Yeah, maybe we can. And so that might be a reasonable goal for that cat.
One thing that we haven't jumped on is, no pun intended, talked about is how aging plays a role with our cats. Yeah, just like any other animal, aging itself is not a disease, but rehabilitation can play a great role in helping your cat to age more gracefully and with more comfort. And so, just like any other animal, including humans, there are certain things that happen. I mean, aging does make healing more slow because there are age associated changes, and some of that can be loss of muscle. There's general dehydration that takes place, but particularly in our discs, I think of that. The brain atrophies. Cats can get dementia just like people and other animals. But, again, we can address a lot of these things and help you to help your your cat to be most comfortable. I think we're always, again, kind of circling back to the beginning when we talked about pain. We want them to be as pain-free as possible. We want them to be as independent as possible, restore mobility. And, that's through some of the intervening tools that we use very commonly in rehabilitation. And just one more thing, I think that safety is always first. If it is no longer feasible for your cat to jump, to that height, that perch, or what have you, we have to do everything in our power to ensure their safety. So, moving the perch lower or eliminating the perch, because if they see it, they may try because they don't know the limitations of their own body. So we need to be the voice of reason. So, especially even digressing back to things like, post-surgical, removing the things like the toys and such that would make them maybe move too much right after an orthopedic surgery. So it can go both ways. We want to encourage movement, but there are certain times where we want to take things away and discourage movement. And we don't want to be like, offering candy to that dieter. We want to take away the things that they can no longer do so that they're not an enticement to them.
I guess I would just like owners to put it in their minds or consider the fact that their cat has similar disease process as humans do. And and you may not think that your cat is a good candidate for rehab, but they may very well be a good candidate for rehab. So talk to your veterinarian, find out what your cat needs, what their needs are, and then reach out to your rehabilitation practitioner.
Yes. And trust your gut. You know your cat better than any other person. Advocate for them. Reach out to your vet. There are things that can be done.
All right, Chris. Well, I think we gave the audience a lot to think about. So I will catch you on the next podcast.
That sounds great, Cathy. I hope you all enjoyed it out there in Catland.
Bye.
Bye.
Thank you for joining us. We hope you enjoyed our show.
Follow us on social media at PetAbility Podcast.
And please check out our affiliates and sponsors.
Simply go to the show notes for information and links.
Thank you, and tune in next time.